And so just some of my background from a patient safety perspective. So my healthcare journey really started back in 2008. I was trying to figure out what to do with my life and ended up getting certified as a pharmacy technician and kind of fell in love with healthcare at that time. And so basically took that and ran with it and ended up joining Judy at Valley Rock College and was a teacher in that program and really enjoyed developing that next kind of generation of pharmacy professionals. Then I got into inpatient and really inpatient quality, so looking at how we improve processes, how we develop people, how we improve programs, the way they perform, and how that kind of connects to culture and outcomes. And then currently, like Judy mentioned, I run a patient safety program locally for the Air Force. I work at a large outpatient medical center, so we're not an inpatient hospital, but we have 2 pharmacy locations. We distribute anywhere from 1,500 to 2,000 prescriptions per week, so we have to take care of our active duty and retiree and dependents, so a very robust system. And so I just really want to talk about really, what you do every day, make sure that we acknowledge that, talk about what went well over the past 15 months when it comes to adjusting to make sure that our patients have what they need, and then what we can do to improve moving forward. So 3 basically objectives that I want to focus on. Basically that partnership between the patient, the pharmacy team, and the family, and how we ensured that continued over the last 17 months. For those of you that work in, whether you're inpatient or maybe you're an outpatient medical center like me, or you're a standalone, how you work with those teams in your system to ensure the pharmacy runs efficiently, and then basically provide some communication tools and show you how we had to adjust those over the last 15 months to ensure we kind of could still continue high quality, safe care. And so when I talk to young professionals and people that are new in the field or even my leadership, I really start with the foundation. So when we talk about connecting these presentations to the AAPT Code of Ethics, it's really just making sure that we start with the foundation. So every brief that I do at my job currently, I usually start with our mission or vision or the strategic plan to kind of bring us back to center. So my goal throughout this presentation is that if you are responsible for taking any of this back and sharing it with your team, to really start with the foundation, because a lot of these code of ethics are going to be found in your own employee handbook, mission, vision, within your own organization. And so really by starting with this, it really brings everyone back to center, to the foundation. Okay, so I want to start with expanding our comfort zone. So I think everyone's kind of heard the saying, success is just beyond our comfort zone. And so I want to start with myself. So, and I'll talk about Judy. And I would say for me, Judy's a comfort zone expander. So a couple of examples of that. So last year when we did this virtually, and she got a hold of me and said, Rich, can you put together a patient safety brief and put together an audio presentation, which is something I've never done. I'm way more comfortable talking to all of you in person than I am trying to sit down at my computer and audio record. And so she kind of forced me into trying something new, which went pretty good. I think I learned a lot from what kind of microphone to use, how to do that effectively at home. But really also to talk about the AAPT as a comfort zone expander. So our goal really is to try to provide you with the knowledge and a foundation when it comes to building upon what you already do well. So everything you've done this weekend really is trying to push you beyond that comfort zone and help you grow in the profession, but also each other. So hopefully the connections that you've made this weekend, when you go back to your pharmacy, you can remember you can always call us. especially from a patient safety perspective. If you're not in an inpatient hospital and you don't have a patient safety manager, feel free to get a hold of Judy. And if you have some questions for me, to reach out. I will definitely help you if I go over something here that you want to try to implement in your organization. So that's my goal, is to try to help you kind of expand that comfort zone. But I think also really to talk about the pandemic in that form as a comfort zone expander. So as a patient safety manager, I'm really responsible for a culture of safety. And so to try to look at the pandemic as what did we do well, and then what things did we learn and can we continue to build upon as we move forward, whether we have another surge or we go into a more normal time. And so the way that you look at what you have to go through really builds upon the outcome that you may have to deal with. And one thing I want to talk about when I talk about what went well or how the pandemic may have expanded our comfort zone is I do think there were some wins when it comes to hand hygiene, because if you look at studies, whether you're in the hospital field or in the healthcare field or just in the general public, even those of us that are educated on how to do hand hygiene properly, it rarely actually happens the way it should. And so for me to be able to see all the extra, whether it's the hand hygiene, hand sanitizer, when you walk into a pharmacy, when you walk into a hospital, when you walk into the grocery store, when you walk into a restaurant, is really a big win. And also too, to see the unique placement. So I think, if I'm trying to cut down on even the spread of cold and flu, having that hand sanitizer station, at a gas station outside of the restroom, knowing that the person probably didn't wash their hands the best, but we're going to give them hand sanitizer, to me that's a win. And I think we have to celebrate what we have learned and what we need to keep doing moving forward. And especially when it comes to the extra disinfection, a lot of the things we see at restaurants, the infection control practices that have started, if we really are honest, a lot of those probably should have been going on this whole time. And so even though the pandemic has caused a lot of tragedy, I really feel responsible for making sure that we do learn from what we have gone through together and try to come back stronger moving forward. So when we talk about patient-centeredness, I think the number one thing that I've learned throughout the pandemic is you can never communicate enough. And it's really about over-communication. And I think this sign's a good example. So this is from Virginia. And I found this. They had this posted on their Department of Health and Human Services website. But just from a communication standpoint, talking about what their pharmacies are offering in the area, I can tell you from my experience going through this, there was definitely a lot of confusion as we adjusted operations, because for us, we went from internal operations to external operations to kind of a hybrid internal and external to drive up. And so every time we shifted, we noticed that you can never communicate enough to make sure the patients know kind of how those operations change. So I think one of the things that we can take away from what we went through together is the way that we communicate with our patients and the way that we explain how they can access what they need when it comes to pharmacy care. So when it comes to patient-centered care, I think one of the biggest fractures when it comes to the pandemic is the way that we embrace patients and their families. Everyone in this room, one of the reasons why we probably love being a pharmacy technician is because we love engaging with patients. And so obviously throughout the pandemic, even just with the mask wear and losing that kind of nonverbal communication really affects the joy, right? The joy and work that we get from engaging with that patient population. But even more, for our facility, we have a monthly patient family advisory council where we try to get feedback on how we're performing, and especially during the pandemic, trying to get that feedback on, are we doing the right things? How can we be better? And so losing that for months, I could tell really affected us when it comes to continuous improvement And so one of the things I want you to think about is, how are you gathering feedback from the patients that you serve? And so it can be as simple as, you may have a survey they fill out, and if that's not something you do now, it's probably something that you could think about implementing, because there's a ton of feedback that your patients could provide just based on what they kind of went through when it comes to the pandemic and trying to access care. And so trying to bring that back together as we move forward, that feedback can really help you improve operations as we move forward and navigate this pandemic. So I mentioned the patient family advisory councils. And so, normally for us, we meet monthly. We have probably 4 to 8 patients who come in that help us basically assess maybe a new process in pharmacy, a new process in a women's health clinic, a new process in radiology. And so that's where we get a lot of feedback on this new way that we operate may work really well for us, but does it work for our patients? And so how are we doing that as we have moved through the pandemic, and how are we doing it moving forward to ensure that they have a voice, and is what we're doing now currently working for them? It's really about that partnership, which really ensures that patient-centered care that we all strive to provide. So just some things that you guys already do well, and I think this is critical to take a moment when you go back to your pharmacy, is to really have a huddle and talk about what went well over the last 12 to 16 months. I don't think we do that enough because there's a lot of things that we should really be proud of across healthcare, and especially at the front line when it comes to what you do every day. When it comes to maintaining that patient-centered care, the way that we actively listen to our patients, the way that we talk to them about how they want to be involved in that education with the pharmacist, if they have concerns or questions, and making sure those are getting elevated correctly. How did we continue to do that throughout the pandemic, and how can we continue to do better moving forward? And so it's just something to think about when you go back. But really, I think number one is to go back and if you do have a monthly meeting or a huddle, to really start with, what are some things that we should be proud of over the last year and a half, and celebrate those, because you probably should continue doing those as you make any other adjustments with your operations. So I talked about Judy being a comfort zone expander for me. So I want to give you an example. So when Judy called me this year and she said, Rich, are you you want to come talk about patient safety? And I said, sure, Judy. Can I talk about high reliability? She's like, Richard, you always talk about high reliability. And then I said, can I talk about safety air prevention? She said, Richard, you always talk about safety air prevention. So for those of you that have listened to me talk before, this may be a refresher, but I did try to adjust it to kind of show some of the things that we did to ensure high reliability throughout the pandemic. For the new people that are here, if you aren't familiar with high reliability, it's basically based on a book, Managing the Unexpected, by Carl Weick and Kathleen Sutcliffe. It really originates from nuclear power and the airline industry. It's pretty standard across healthcare. Most hospitals usually have it built into their orientation. Every staff member that comes into my building gets an hour training on what high reliability is in our organization. So we have it standardized to fit what the Air Force does and how they can help us along this high reliability journey. Now there's 5 principles that we're going to kind of go over and dive into. The first 3 really help us try to stay out of trouble, or avoid error, and that's preoccupation with failure. That's why we huddle in the morning, to try to anticipate what could go wrong before it does. Operational sensitivity. So when I talk about the way that we've adjusted services over the past 12 to 16 months to meet our patients, to provide that continued access, that's really when that operational sensitivity comes into place. And then the biggest one is, there's been so much guidance, right? We talk about audible alarm fatigue or visual alarm fatigue. There's so much guidance that comes out all the time about how we need to adjust to be safe and provide that access. And so to make sure that we are reluctant to simplify the way that we interpret the information we're receiving, something you do every day when you dispense a medication, you're doing that. But it really is critical as we get CDC guidance released and updates on how we need to provide care, to make sure that we're really questioning what we're receiving and how can we apply it to what we do on a daily basis. Now, what I tell my staff every day, our goal is zero harm and not zero error. Errors are going to happen, okay? So when errors do happen, it's about a full commitment to resilience. So how do you respond? How does your team come together to try to build back stronger? And so that daily huddle to come in and say, okay, yesterday we had an error. What can we do to prevent that error today? And that's how you start building that resilience back into that one person, into that team, and hopefully move forward and be better. Now, the last one's my favorite principle of all of the five, and that is deference to expertise. And that's because in healthcare, we have something called power distance. And so we have it in the military as well. But so in my case, we have military rank, and we have in healthcare, we have providers, nurses, and technicians. And so when I talk about deference to expertise, it really means that if we're trying to solve a problem, do I have the right people in the room? And so if I want to learn how we dispense medications or how something could have broke when it comes to dispensing, I'm probably not going to go to the pharmacist. I'm going to ask the technician who does it all day. So deference to expertise really helps eliminate or at least decrease that power distance and gets the right people at the table to solve the problem. So the first thing, so preoccupation with failure. So how can we use that right now as we move forward? So as guidance changes, I'll tell you for us, one thing is we still see that sometimes a patient will get into our facility without wearing a mask. And so preoccupation with failure, right? So what can we do to try to eliminate that from happening? Well, we can put someone at the front door to do screening, which a lot of places have kept that throughout. We've kind of went back and forth between having a screener and not having a screener. You can hand out masks, but also preoccupation with failure, we've also seen that those masks tend to disappear if we leave them just open for everyone. So really thinking about if you're having breakdowns in access or patients getting into your pharmacy, whether you're a large hospital or maybe you're just a standalone, how are you ensuring that, one, they don't make it in without a mask? And then if you're providing those masks, how do you ensure you're accountable for the stock that you have to make sure that you have enough for your staff moving forward? So I talked about operational sensitivity, and I talked about, for us, kind of watching us go from internal operations to we were dispensing external to our clinic to developing a drive-through system. And so how are you communicating those changes not just to your patients, but to your staff, right? So not just the external communication with like social media, whether it's Facebook or Twitter, but how are you communicating internally that you've made changes when it comes to how you're going to operate in the pharmacy? Because it's very easy for clear communication to break down, and next thing you know, you have an error or maybe a patient safety event because of that. Okay, so the third thing I want to talk about is our reluctance to simplify our interpretation of information. So last year, for those of you that had a chance to see the virtual presentation I put together, I talk a lot about huddle boards and huddling and how are you tracking data. And so the easiest way that we can ensure we are not oversimplifying the information that we either are generating, so we all generate data, or that we're receiving, is to track. And so on every huddle board in every clinic we have, so we have 51 huddle boards in our facility, we have a section for key performance indicators or metrics that we have adjusted or we've been tracking throughout the pandemic. And so for us, when you walk through different huddle boards, you may see, for example, how are we doing on COVID-19 vaccine stock? How many vaccines have we administered today? How many are scheduled? How many we've done this week? But most importantly, to making sure that you align, once you open a vial, the number of vaccines you want to administer versus the number of people scheduled or that are walking in, and how do you ensure that you're trying to reduce waste as much as possible if you can. But the other thing too is to recognize the good catches, right? As we change guidance, if we want to build back that resilience into the system, we have to recognize when people are doing great things every day. And so one way you can do that is, how many good catches are we seeing? What is the good catch in your pharmacy? Everyone works in different areas, whether it's an inpatient or maybe you work in a smaller, CVS, Walgreens. So what's the good catch in your system, and how are you tracking that to make sure that we're giving that staff that feedback? And then I mentioned earlier, with the preoccupation with failure, is tracking, if you are disseminating masks in your pharmacy because you're the single point of entrance, then how are you tracking that? And those are all things that you can do at your morning huddle or when you have your meeting to make sure that you track all those metrics and we don't miss something along the way. Now, commitment to resilience, and I think this has been, for me as a patient safety manager, how do I keep my staff upbeat over the last 16 months? How do I build that resilience and get our culture to sustain that goal of chasing zero harm? And it's really about celebrating those kudos and wins. And so for you, it may be that one of your you have a new technician, they join the AAPT. That's a win, right? Because anytime you surround a new employee or a younger pharmacy technician with a group of people that are passionate and committed to excellence, that's going to help them be successful. It may be that one of your tech got certified. That needs to be celebrated. That commitment to continuous growth is critical when it comes to our number one job of providing high quality, safe care to our patients. And then also, definitely track this is number of days since last dispensing error. Now, dispensing errors may be rare, but it's still critical to track that. What's the record for your pharmacy? How many days has it been? How many prescriptions? When you have a new employee, if you tell them, hey, welcome to our team, it's been 440 days, now you're a part of that record, you're going to help us build upon that. If you do A, B, and C, we're going to be successful. That's big. That's how we build better teams, better people, and hopefully reduce error from ever reaching the patients. But I mentioned that it's not about, it's about zero harm, not about zero error. So when errors happen, how do we respond? And so I want to talk about deference to expertise. So I talked about all of you in this room. You guys are all experts in your field. That's why you're here. And just remember that as you're adjusting your policies, your processes, to make sure that you're deferring when it comes to local and national guidelines, CDC, APIC for infection control. Are we following those guidelines? But most importantly, that you're leaning on each other, right? So you have the AAPT. We are here for you to help you if you have questions. And so deference to expertise means you can lean on everyone in this room to reach out. This is your community. Like I mentioned, even though I may answer to Judy, I tell my staff I work for you. And so it's one of those things where deferring really helps us be safer when it comes to providing high quality, safe care. Okay, so for those of you that have been through Team Steps training, so a lot of hospital pharmacies probably have been through Team Steps training. One thing they talk about is try to understand how the pharmacy interacts with the rest of the system. And so in my situation, the patient's at the top. We have a core team, which is usually the primary care team. We have our coordinating team, who's kind of like our schedulers, referral management, admin folks. We have pharmacy and lab and radiology, our support services, and then we have leadership. But the big thing to understand is throughout the pandemic, we've actually had to add a contingent team. And a contingent team is usually a short-term, hopefully, a short-term team put together with people from all of those areas, which we saw when we had the stand-up testing sites and vaccine pods. And so when we had to develop those, that's when we have a contingent team, a team of maybe a core team, a pharmacy tech, a nurse, an admin staff. And so how are those groups communicating really determines the success of the whole system. So as I mentioned, external pharmacy operations. And so how you adjusted and how your system's communicating with the patient, the core team when it comes to that primary care physician, that nurse, that technician, that coordinating team, that admin staff, is critical. So whether it was you had daily huddles and you sent out an email to all the people that really were involved in that process to make sure that there was clear, continuous communication. But for me, I think that was the number one thing that we learned, throughout this pandemic was how can we ensure that everyone knows what's going on, and how do we know that everyone knows the expectations, especially when we're doing operations different when it comes to doing delivery services or external operations and so forth. So you are a key component when it comes to the foundation of the system that we all operate in. And obviously this pandemic has had us even add to that when it comes to putting together external operations. So patient-centered care really comes down to four things. It really tests the culture within your pharmacy, the care and how you ensure that they get what they need on a daily basis. I will foot stomp the communication and how that's really critical when it comes to maintaining that access, ensuring that patient knows how to get those prescriptions they need, but more the collaboration. How did you ensure collaboration as we navigated through the pandemic? And so we're going to kind of touch on some things that we did and some things that either maybe you've been doing as well, but maybe if you could think about adding as you move forward. So culture. So it was really difficult for us to maintain that high level energy from a culture perspective when I don't get to see my staff, when we're having virtual huddles, when we're using Teams. And so the number one thing I could recommend is when we had to go from in-person huddles to in-person meetings to virtual, we developed virtual OneNotes when it comes to having a place to keep track of everything that we were discussing that everyone had access to. So if people aren't on that call, if they can't make that huddle, that there's an access point for information to try to make sure that those kudos, those wins, all those things we want to keep doing don't get dropped because we're not there in person and we don't get to see each other on a daily basis. So when I was doing my research for this, I really wanted to see when it comes to pharmacy operations, what's kind of the model for patient-centered care. And so since we're Joint Commission accredited, I wanted to find a model that really they recommended when it comes to trying to ensure that continuous improvement, continuous communication. And so this was the main model that the Joint Commission recommended using. And really, it's very similar to those of you that understand process improvement. There's a model called Plan, Do, Study, Act. It's PDSA. It's pretty simple. You plan, you research, you execute, you study to see how the execution went, and then you act. And you continue that model continuously. So you never stop. You always do PDSA. And when you look at this model, that's what they're recommending. So you want to collaborate, communicate, and document. But really, it's about collecting information, assessing the patient, plan what's best for that patient, implement that plan, and then a continuous follow-up and monitoring, so we are always evaluating how that patient is doing, and it never stops. And so, You do this every day. That's what I'm saying. Celebrate the wins. We don't do that enough. And that's the thing. Sometimes when we see these models, we need to stop and realize we're doing this, right? You guys do this every day. It's just time to put a name to it and discuss it with your teammates, your new technicians, your pharmacy leadership, and say, this is what we're going for. This is what we do. This is what we're great at. But it should never stop. So we're always collecting information, assessing, but also don't just apply this to patient-centered care. Apply this to always improving the way that you operate as a team and as a pharmacy, right? Because it will go hand in hand. When the pharmacy operates well, when the team communicates clear, patient-centered care will follow, okay? So, clear communication. One of the things that I saw that was hindered for me, which I'm thankful I'm here today without a mask on to talk to all of you, because I really lost a lot of those nonverbal cues when I was wearing a mask trying to explain to my staff about patient safety. And when we talk about communication, I think one of the reasons why it probably affected all of us so much, because we love interacting with our patients, and we weren't able to see those smiles. We weren't able to tell if they wanted to ask a question but weren't going to. We weren't able to anticipate how they were doing based on their smile or frown or those nonverbal cues. And so when you look at clear communication, kind of the father of linguistics, Edward Sapir, really said it best. So nonverbal communication is a secret code that is written nowhere, but we all know it, right? We're all great at it. That's why we're in healthcare, because we understand that our patients understand nonverbal cues and we understand theirs, right? So we can tell when they're not doing well. We can tell when they need some comforting words, and unfortunately we lost some of that throughout the pandemic. Now, to start off, so 55% of our communication with our team members, with our patients, really comes down to our body language. So we still were able to maintain some of that. Our ability for our patients to see us, the way that we stand, the way that we talk to them, the way that we direct ourselves towards them. The body language is still 55%. Now, the mask did affect, I do think, when it comes to the 38%, and that is when it comes to our tone and pitch and rate of speech. I think that we did lose some of that, and unfortunately, and we're resilient, but that's just something that we had to work through for you at the front line when it comes into engaging with those patients, is we lost some of that with those masks on. But the key thing to realize is we still have the body language, and we still have the 7% when it comes to what we're actually telling them. And so you all should be very proud of yourselves on the way that you did navigate this pandemic, the way that you kept patients feeling safe, you kept them coming back, you provided the access, and made sure they had their medications. Now, collaboration. So kind of going back and kind of attacking that patient and family advisory council. How are you gathering that feedback from your patients? That's the biggest key over the last 12 to 16 months is the collaboration. How do you maintain that? What are you going to do moving forward to ensure that you're getting continuous feedback from your patients? Because it's critical. There may be changes that you made over the past 16 months that you should keep doing, right? And you may not know that until you sit down and talk to your patients. There may be some best practices and some things that we were forced into over the last 16 months that we wouldn't have tried before. And so just please make sure that you sit down and talk to your team. Try to, even if it's over the phone, asking your patients, what has went well for you as we've navigated this pandemic. Gather some of that feedback. That's how we really come back stronger from all of this, is what went well, what can we keep, and what do we need to continue to improve upon as we move forward. So building upon team steps, building upon huddles, what you do every day, it's really about four things. So when you get together with your team, as we continue to navigate forward, it really comes down to the status of our patients. So how are our patients going to continue to access what they need from us in the pharmacy? How are the team members doing? How are the staff doing? Is everyone doing okay? Mentally, physically, I say biopsychosocial. So obviously we've been more detached. So how is your team doing? Environment. So this could be equipment. This could be infection control practices. How are we doing with hand sanitizer, with masks? The environment of care that you support in the pharmacy, how are we doing? And then progress towards the goal. So that goal that you set every day, whether it is number of prescriptions dispensed or how patients are going to access care, that goal that you set, how are you doing towards that goal based on the patient, your team, and the environment that you work in? That's kind of like a continuous process as you huddle, as you talk, as we continue to improve, as you move forward. So I've touched on the huddle boards before, but I just want to talk about, this is one example of what we use in every clinic in the pharmacy. We did switch to using OneNote. So basically we built this template into OneNote and filled this out every day over the phone. Now we are back in person, but it is a good example where you can adjust and still fulfill that clear communication. And it really does provide you a template of things you should be thinking about to ensure patient safety and high quality safe care. So one, what's your daily and weekly plan for the pharmacy, right? So whether it is maybe you have a new employee, so you have some orientation to do, maybe you have to make some adjustments based on local, state, and federal guidelines. Now I talked about KPIs and metrics, so you really have to ask yourself, what are those KPIs and metrics for your pharmacy, right? Because every pharmacy is so different. And so you may be an inpatient hospital pharmacy, your KPIs and metrics are going to be very different than maybe an outpatient CVS, Walgreens, maybe a smaller operation. Now, the next is the best part of the huddle board, and that really starts with the concerns and frustrations. So this gives you a voice. So these huddle boards really start there. So when you huddle with your team, you basically going to ask your whole team, do you have a concern or a frustration? Right? So everyone's going to be at the huddle, or if you're doing virtual, is there a concern or frustration? You're going to put it on a sticky note, and you're going to put it on the board or on the OneNote. Okay? Once it's on there, there's only 3 places it can go. Okay? Once you have a concern or frustration, there's only 3 places. It's either a just do it, so you can fix it. It either goes down, and you can fix it right there, and you can improve upon a process, or you can eliminate that concern. It is more of a 4-step process, so you go to the right, and you work through what's the problem, what's maybe the root cause of that concern, what can you put in place to correct it, and then how do you trend the results? Or, and this is the most important thing, or it needs to be elevated to leadership. And usually what I tell my staff is really, it should never stay on there as a concern or frustration for more than a week or 2 before it's elevated. So I want you to fix it at the lowest level. I want you to work through the problem. And that's why we round on our boards twice a month. So if it's there, the next time I come, then it probably needs to be elevated. So we kind of put a clock on that to make sure that the front line gets the support that they need. And lastly, the most important thing, please, I can't stress this enough, is please always remember what you guys do well every day and celebrate those kudos and wins. Like I mentioned, that's how you build resilience, especially right now and over the past 16 months. And I think the big thing is when you do this is you're really asking yourself every day when you huddle, are you safe, right? So for your staff, and this is what this acronym means, is every day, if you go to one of our huddles, the very first thing they're going to ask is everybody safe? Number one thing. Now, sometimes a staff member may not speak up then, and they'll go to a manager afterwards and have that discussion if they're not in a good place. But it's just something you have to ask every day. Are they safe from illness, medication, stress right now, stress, alcohol and drugs, fatigue, eating and elimination? And so it may seem simple, but I've really seen this work. And if you ask it every day and you have a great culture and you communicate, it really will empower someone to speak up and let you know if they're not doing well, which that's the win, right? That's when you can tell your culture is working, when people are comfortable saying, I'm not okay, I need help, I may need a day off, and that sort of thing. And so I wanted to give you an example of what this could look like. So I talked about the STEP acronym. So we build the STEP acronym into every huddle. We just shorten it. So instead of STEP, we just ask our staff 3 things. Do you have any environmental concerns? Do you have any equipment concerns? Is there any staffing concerns? Or is there any patient safety or patient access concerns? And every clinic has to brief that every day at our Zero Harm Daily Huddle to make sure that we're assessing that environment of care, making sure that we're ready to go before we see patients. Now, as I mentioned, you go down and you see those KPIs and metrics. And so I mentioned you could talk about your vaccine stock, how many vaccines you have administered, good catches, how many masks you've disseminated. A lot of these metrics will be based on your individual pharmacy, but this should give you kind of a starting point on how you can implement this. But as I mentioned, the most important piece of these daily huddle boards is when you get to concerns and frustrations. So as I mentioned, once you get to concerns and frustrations, like for example, for a while we were scheduling our vaccines, right? So we went through a process where we were doing scheduling. Well, then we started having no-shows, right? So you have to figure out what your concerns are. For us, a patient no-showed, okay, so either it's a just do it or we have to work through a 4-step process. And so the first thing we started doing is, hey, we'll call some patients, and if they have a future appointment, we'll get them in earlier to make sure we don't waste that vaccine. And then, okay, let's only schedule the amount of patients for the amount of dosages we have per vaccine. So it's really about continuous process improvement as we figure out how to do this better moving forward. So we had a concern. It was either a just do it, which we did a couple and we're still improving. We're actually doing walk-ins now. It actually works better to do walk-ins for us. But we had to learn as we went through this. And so we had concerns. It was either a just do it to try to fix it right there, or we could have worked through a more of a 4-step, or you have to elevate to leadership. But just to kind of foot stomp, please, the kudos and the wins, it really comes back to that, especially right now. Make sure, whether you had a new tech join the AAPT, you had a tech get certified, you had 0 dispensing errors for 30 days, whatever those metrics are for you, those wins, please make sure that you celebrate those. It helps morale, it helps resilience, and it helps your culture retain employees as you move forward. Okay, so as I end, so I'm kind of dating myself with this. So I'm a big He-Man fan, so I know if you guys have Netflix, there was a new He-Man launched last week. But I think here's the thing. So we learned yesterday that a lot of you some of you drove 1,500 to 2,000 miles to come spend time with us. And we want to be a part of that journey, right? And so this has always been my favorite quote, because life is about living the journey. I don't like saying goodbye. It's really about that good journey. And so hopefully as you move forward with the AAPT, that you have us be a part of that journey, that you get a hold of us if you need help, because we really are, as we've said throughout the pandemic, better together. And this is why we do this, to try to help you and then help our patients that we serve.